Entonces, puede usar la interpretación es para todos que no sean completamente bilingüe. Entonces, para usar la interpretación, va a ser un globo abajo de la pantalla y puede hacer clic y elegir su idioma y dice done y eso está. Y si está usando teléfono, va a ser 3 puntitos. Y por favor, para ayudar con hacer un espacio accesible, por favor, habla con despacio. Y si está hablando muy rápido, vamos a avisarles en el chat o con un señal. Y si tiene cualquier pregunta o quiere hablar sobre justicia del lenguaje, puede avisarnos, mandar un mensaje y gracias por tenernos. So my name is Sarah. I'm one of the interpreters, the Spanish interpreters, along with Fatima. And the interpretation function on Zoom is today for anyone who's not bilingual in English and Spanish. So if that's you, you can click the globe on the bottom of the screen and choose your language, then click done. Or if you're on a phone, it may be 3 little dots. And to help create a more accessible space, you can help by speaking at a not too fast pace. And we will let you know if it's getting really fast by sending a message in the chat or practically doing this. And feel free to always send a message if you have questions or want to talk about language justice. And thank you so much for having us.
Thanks so much for being here, everyone. Also want to invite folks, if you're using the chat, to follow, for instance, Fabian's example and translate your chats. So make sure that you use DeepL. It's better than Google Translate, but make sure if you're chatting in Spanish to also translate into English, and if you're chatting in English to translate into Spanish, because we want everyone to be part of every layer of the conversation everywhere. So welcome. My name is Andrea. I am a co-founder of Interrupting Criminalization. For folks who can't see me right now, I am a very light-skinned Black woman with curly hair and blue-rimmed glasses in a tank top because it's 97 degrees where I am in Waweyatanong, which is on the traditional homelands of the Anishinaabe people. And I'll put those in the chat. I should have done that before. And it's also known as Detroit. And I am here today, super excited to welcome all of you into this space with the musical break that Aaron gave us. It's a rough day today. The police raided the offices, or the home actually, of 3 people who run a bail fund in Atlanta, claiming that they are engaged in some kind of financial fraud because they oppose the construction of a police training facility and have been supporting protesters in the fight against it. If you need more information about this, if you don't already have it, just follow the Stop Cop City hashtag on any social media. You'll find out information. So it's a difficult day, but also a wonderful day to come into a room and find 54 people who are ready to jump in and resist criminalization in the context of provision of medical care. Many of you are here because you already know about Interrupting Criminalization's Beyond Do No Harm Network principles to interrupt criminalization in the provision of medical care. But some of you might just be here because you saw something on the internet and you're a healthcare provider and you want to learn more about interrupting criminalization that happens when people seek care or when people are incarcerated, and that's what we'll be focusing on today, and are either not getting care or are getting abusive and violent medical intervention, coerced medical intervention that's being called care. So the link to the principles, there's 13 principles that were developed by over 60 advocates in movements around criminalization of pregnant people, drug users, migrants, disabled people, people in the sex trade, HIV affected people, and parents. And all of those groups experience criminalization in the context of accessing healthcare in different ways, but share that experience sometimes in similar ways. And so there's 13 principles that folks crafted together to ask individual healthcare providers, institutions that provide healthcare, and healthcare associations to not just sign on to, but to adopt and implement as part of a commitment to do no harm, recognizing that criminalization is itself harm. And so if you haven't already signed on to those principles, please do so in the chat as an individual or as an organization or as someone who is part of an association. And what we've been doing to make sure that people are supported in implementing these things and really making sure that we're making our commitments to not engage and participate in or further or promote or collaborate in criminalization of people who are seeking medical care is that we have created these monthly sessions to kind of sit with each of the principles and really think together about why we need that principle and what making sure that we're following and adhering to that principle looks like. And tonight we're tackling two really difficult ones, actually. They are principles 11 and 12, and they are to stop providing and or sanctioning substandard or I'm sorry, someone just decided to mow the lawn and cause me. Okay. To stop providing and or sanctioning substandard or violative care for people who are in some kind of custody or incarceration in jails, prisons, detention centers, residential centers, group homes, or state facilities. So in other words, if someone is incarcerated, let's not deny them care or provide violative care or substandard care. And also, the second principle that we're talking about tonight is to stop collaborating with the criminal punishment system to violate people in custody, including by performing cavity searches at the request of police or prisons or immigration officials, things like healthcare providers evaluating folks' competency to stand trial or to be executed, experimenting on and sterilizing people who are incarcerated, or facilitating torture or administering the death penalty. So we're saying when folks are caged or controlled by the carceral system, their care is entirely under the control of the state, and we don't want to participate in offering substandard care or no care or neglect, but also we don't want to collaborate with the carceral state to violate people's rights and torture them. And then why I said it was hard is simply because if we don't want to support prisons at all, or the existence of prisons or immigration detention or people being under carceral control, then it's hard to provide care and not be somehow fueling the system. So we'll be talking to people tonight about how they thread that line. So I'm going to stop talking for a few reasons and introduce our expert panel tonight, who are the ones who really know deeply how the struggles of navigating these issues and also how folks are resisting them. So I'm just going to invite folks to describe and introduce yourself and talk about how you organize, how you've experienced medical care in carceral settings, and how you're organizing around, if you have, and or how you're organizing around these issues. And then we'll come back around a few times with some questions for folks. So I'm going to start with Andrea James to ask you to introduce yourself and describe how your work connects to medical care in carceral settings.
Well, thank you, everybody. Thank you for this opportunity to join this discussion, a very important discussion personally, and a very important discussion for our membership. Andrea James, the other Andrea, and I am from the National Council for Incarcerated and Formerly Incarcerated Women and Girls. I want to just give a huge hug to my comrade Jason, who I have not seen in some time now, but love dearly. We did a lot of work here in Boston before he moved on, but really happy to see you, Jason. So that's who I am, and I'm formerly incarcerated. Spent 2 years in the federal system in a prison for women in Danbury, Connecticut, and experienced firsthand the lack of appropriate care. And I was pretty fortunate because I was pretty healthy while I was incarcerated, although I went to prison just a few months after delivering my baby boy, who was 5 months old when I went in, and still breastfeeding. So it caused a lot of difficulty walking into that prison, but also mostly experiencing the horrible treatment, criminal treatment of women. That is criminality, the epitome of it, of the women who are very sick and who are in need of care, and instead were neglected, and some died. And so that's part of the work that we do now at the National Council. We sue prisons, we fight for appropriate health care, we fight to bring women out of prison who have dementia, who are long timers, and who have very significant illness. We fight for everybody just to get out, but particularly for the sisters who are struggling due to very serious health conditions. And so I'll stop there just as an introduction, but that's my connection to this issue. Thank you.
Thank you, Andrea. We're so grateful to you for being here, and folks are already asking for information about the council. So I hope everyone checks out the link in the chat, and we'll come back around to talk to you about how you see folks resisting and how we balance what you were just saying, which is we want everyone out. And while people are in there, we want to make sure people get the care they need. I'm going to go next to Jason because you mentioned Jason, and just to keep it on that tip, and then we'll move on from there.
Thanks so much, and such a blessing to be with everybody this evening. My name's Jason Lydon. I serve as the minister at the Second Unitarian Church of Chicago, which is how I spend my life these days. But I'm here in this space because I founded and served as the national director of the organization Black and Pink, a nationally networked, I'll slow down, grassroots organization working to meet the immediate needs of LGBTQ and HIV positive folks affected by the criminal legal system, while simultaneously working towards the abolition of the prison industrial complex. Thanks for the shout out, Andrea. Love right back at you. I'll be in Boston in July. Let's hang out. So I come into this work as one of the co-authors of Coming Out of Concrete Closets, which remains the largest ever survey of LGBT and HIV positive prisoners. And we reported on the experiences of folks inside, including experiences with the medical system and what's going on there, and looking at the ways that the medical system inside perpetuates sexual violence, the ways that it furthers criminalization of people when they reach out for care, maybe if they're using drugs while inside and they're trying to get basic care and needs met, or maybe they contracted an STI and they're now getting a write-up for PREA violation because they've contracted chlamydia, and people reaching out for medical care but being either denied because they can't pay for it, or choosing not to access care because they don't want to pay the fees involved that are often exorbitant, depending on where people are locked up. And then I also, just to add to this conversation a little bit, mental health facilities that are not technically prisons and jails are still carceral centers. And I've recently spent quite a bit of time in them these past couple of years. And People are really being punished for being mentally ill rather than supported and cared for. And so I think these things are really interconnected. And so I'll likely be talking a bit about that as well. And again, I'm based in Chicago, which is the land of the Three Fires Confederacy.
Thanks, Jason. I'm gonna now swing us across the country to Amber Rose Howard, coming to us, I think, from the land of the Tongva people, but welcome, and please introduce yourself, tell us how you come to this issue.
Yes, thanks so much, Andrea. Good to see your face. Hi, everyone. Amber Rose Howard here. Please call me Amber Rose. I am definitely from the land of the Tongva people. Really big geographical area out here, and love being connected to folks out here. I'm currently sitting as the executive director of Californians United for a Responsible Budget. That's also known as CURB. And centered in this work through my own experience being formerly incarcerated, specifically centered on this issue because of what I experienced inside. Definitely not only saw the medical and health care neglect of people inside, but also the abuse of people inside, right? The health abuse of people inside. I experienced some of that, but to Andrea James's point, I was pretty healthy in my carceral experience, but watching what was happening to all of the people surrounding me at the time really propelled me to think further about how people are experiencing life inside of these cages. And so coming to this work, I'm happy to share a little bit later on about the work that we've partnered with CCWP, with human impact partners and others, and thinking about what are these health harms, how do we address them, and still move toward abolition. So really happy to be here and learn and share with you all. Thank you.
Thank you so much. And speaking of CCWP, California Coalition for Women Prisoners, so much of what I know about healthcare and lack thereof and torture in carceral facilities, I also learned from Colby Lenz. So Colby, can you introduce yourself and tell us how you come to these issues?
Sure. Sorry, I have a pop-up that I didn't expect. Hi, everybody. I'm Colby, and I'm going to try really hard to speak more slowly than my usual. I'm also in the land of the Tongva people, and I came into this work as a volunteer, I guess 21 years ago now, through some people in New York who I didn't realize were volunteers with CCWP previously in California, and then I moved out to California in 2004, connected with CCWP directly, and started doing prison visiting shortly after that. So CCWP, which is short for the California Coalition for Women Prisoners, started inside the women's prisons in California in the mid-90s. Actually started on the issue of health care, neglect, and abuse, and women on the inside organizing basically to sue the state for such horrible lack of medical care and looking for support from the outside. So, I got into that work some years after that, and in the process have been educated by incarcerated people and their families and formerly incarcerated people about this profound problem and strategies to fight for release and to support people to fight for their survival. And have also do the work now with Survived and Punished, national group working to end the criminalization of survivors of domestic and sexual violence, and the Transgender Advocacy Group, which is a coalition of many different groups in California working to support and fight alongside incarcerated transgender, non-binary, and intersex people. And all of that work, is deeply connected to mental health and medical care, neglect, and abuse in the prisons here. So I'll pass it back to you, Andrea.
Thank you. I just wanted to mention, because we had hoped that someone from the Transgender Law Center would have been able to join us today, but they weren't. I just want to name that part of the way that I have come into contact with this issue is both representing people as an attorney. One of my first clients with someone whose leg had been amputated because he just didn't get proper care for a routine infection in a New York State prison. And then also advocating for healthcare for Mumia Abu-Jamal and other political prisoners, especially aging political prisoners, but also around this question of people getting access to gender affirming care inside. And that is one way in which I saw healthcare providers both serve as allies to people inside and also contribute to violence, neglect, surveillance, and punishment. So I want to name those things both because they bring me in explain why I'm here, but also because it's one of the areas of healthcare for folks who are incarcerated that is one where we end up in these difficult places often. So without going further on that, and also just for folks who haven't been to one of these sessions before, the format is we sort of have this conversation with folks who have experience around the principle that we're talking about, and then we go into breakout rooms for all of you to talk together about how you are going to address the issues that we're talking about. So this is not just a delivery of information that some of you may already know. We're going to, in the second hour, ask folks to go into breakout groups, either based on your affinity group that you came here with. Some breakout groups are based on your profession. So if you're a doctor, there's a breakout group for you. For a nurse, there's a breakout group for you. If you are a social worker, there's a breakout group for you. If you're a public health worker, there's a great breakout group for you. And if you're none of those things, there's also a breakout group for you. So we just wanted you to know that you should be attending to what's being said, because we're going to be asking you to think about how you are going to stop this going forward. We're not asking folks to share their experiences just to tell stories, but to help inform your resistance. So with that, I'll come back to you, Andrea, to ask you, I know we could be here for like 10 days talking about all the forms, all the ways that healthcare providers either don't provide healthcare, provide shitty healthcare, or participate in things in torture like searches to assign someone a gender or to find drugs, for instance. So there's so many ways it happens, but if you could share a few ways that you see healthcare providers collaborating with punishment, and also how you've seen healthcare providers resist collaboration with punishment in the settings you've been talking about.
Well, first I want to lift up CCWP. You know, they are the organization that really has informed us at the National Council. And we share Fighting for Our Lives, which is the documentary about Cherise Shoemate. And it means so much to us because we organized inside just like that. And but we always want to honor Cherise and those sisters who are inside fighting for all of us, for incarcerated women everywhere. And it's still just as poignant now of a documentary ever. So, and thank you, Colby, for all of your continued work in CCWP. You know, one of the first things, you know, from way back 10 years ago, fighting to end shackling of pregnant incarcerated women, something that happens still to this day inside of, depending on where you land or who's not watching. You know, we lift up nurses, because the nurses actually have been the group that have stood, you know, and held the ground for us when sisters come in about to deliver their child and are shackled still, depending, you know, in the federal system, if you're going through transport and you just have the worst luck of winding up in one of these really horrible county jails during your transport, or even in any other prison where they can get away with shackling. Shackling is still a really big issue in this country that is extraordinarily harmful. So, you know, we have other situations. Just last week, want to lift up Silva family, you know, their mom, Stasha, who died last week, and we received an emergency call because the Federal Bureau of Prisons was attempting to cremate her body. She was sent to the hospital a week ago, and she needed emergency heart surgery. And the guard who transported her refused, because there was a policy that stated that there had to be 2 guards in order to make a decision to prolong a person's visit to a hospital. And so Stasha was sent back to Waseca, and she died of heart failure. And these are just the tragic cases of neglect and just callous disregard. A medical doctor is telling the prison guards that this woman needs immediate emergency surgery. We have, so many cases like Andrea Circlebear, who was sent from a county jail while pregnant and then moved to a federal prison to begin her sentence and died, contracted COVID while pregnant, had to deliver the baby by C-section, and she died. A young, very young mother who never, ever, for us, and for so many here, we understand that prison is an act of violence. There is no other way to describe it. Prison is a toxic environment. It is unhealthy. Just the process that you have to go to prior to becoming incarcerated, the prosecution, the indictment, the criminalization of you, these broad brushstrokes of every person that has to go through this, the level of stress that it causes to you, even prior to, the illnesses that you can't see necessarily, that aren't, demonstrated physically, but internally what we go through because of this criminal law system is just completely violent. And it's a failed system. It causes harm no matter what. And so we know that, for instance, there's a company called WellPath, and many prisons around the country contract with WellPath. WellPath had to change its name from Correct Care because of all the lawsuits piling up against it. But WellPath gets a monthly fee from each system where it operates. If it saves money, it profits. Its profits go up. And of course, any expensive medical procedures cut into their bottom line. We sued WellPath not too long ago for failing to treat a woman in Pennsylvania state prison in Muncie who had diabetes, and they had previously lost the doctor who was caring, which is another issue. The medical professionals inside many of these places, the doctor who was caring for the woman that we sued on behalf of had lost her license, to practice. And yet she is in this prison, malpracticing on women who are there. And so the nurse practitioner couldn't even explain in her deposition about how diabetes works. And an outside physician prescribed time release medication, which WellPath canceled because it was is referred to as non-formulary, which is meaning too expensive. So they did not renew the prescription. And so this is why. And for 6 weeks, she didn't receive her medication and her blood sugar skyrocketed. These are just examples after examples of horrible care. Being incarcerated and on your menstruation, the absolute, just inhumane treatment, coming off of a visit from being with your children and your loved ones and having to literally pull tampons out of your cavity, out of your vagina, and hold it up while you're still menstruating, but holding it up and proving to those guards that you aren't carrying contraband. As you've mentioned earlier, the strip searches, the cavity searches, all of these things, we could go on, but I'll end here by saying one of the things that you recognize when you go into prison is that the level of stress and heartache from being separated from your loved ones, your children. Some of the sisters don't even know where their children have been taken. And that alone is almost suffocating, and causes just this mental insanity of stress and worry. But there's two things that you always recognize is that you either pull yourself together if you can, and you try and go and find some way to work out. You find the track in the prison if they have it. If you don't, a lot of times in the jail, you're just held in a cell 22 hours of the day. But whenever you can, you try and get it out by physical exercise. And then there's the pill line. The pill line is sad, it's long, and we witnessed that, the drugging, the psychotropic drugging of the sisters inside, because they need help just trying to deal with the pain, the loss. If you've ever been in a woman's prison at 3 o'clock in the morning and heard a woman just, trying to hold the sobs back to not disturb other people around them, but just unbearable to be separated from their children. That is all part of this. That is mental anguish. That is illness. It causes illness. And so I'll stop there.
Thank you so much, Andrea. I feel like that it's such a, that's why we create these principles, right? That to name criminalization itself as a harm, that as people who are committed to caring for people, to improving health and well-being, and most of all, to doing no harm, can't collaborate with this process, the whole process, because it is harmful to people's health and well-being in the way that you described. And then I love the way that you listed one, resistance to kind of the profit motive around denying people care, but also just that healthcare providers can resist just the mundane neglect, right? And can step in and say, no, you will not take this person back, right? And I'm sure that doctor did, but what more could we do is what we're here to problem solve around, right? What more can we do to make sure people get the care they need while also advocating against the system as a whole? So I really appreciate all the places that you talked about where people could intervene. Amber Rose, where are you seeing, what kinds of things are you seeing, and where are you inviting people to intervene?
Yeah, thank you so much. I think that, with all of the harms that Andrea just talked about, they happen across the state, right? It's not exclusive to any prison or jail in this country. Happens all over the place. And I think that what I'd like to direct attention to specifically is what CURB was a part of in Los Angeles County here in California. There's a gender responsive advisory committee that was formed in Los Angeles that decided to look at all of the harms that folks are experiencing, and decided to write up a report about these experiences to see what could come from it. This was in partnership with Human Impact Partners, California Coalition for Women Prisoners, and then TGI Justice, which is Transgender Intersex Justice. It's an organization based in Oakland. So what we notice here after interviewing and surveying folks who are incarcerated at Central California Women's Facility, it's one of the women's prisons here in California, is that, literally most of the people experience harm. So 83% of survey respondents reported they experienced medical abuse or neglect while in prison. 72% said that they had to wait a long time to receive treatment for something they were diagnosed with or for an injury that prison officials knew about, right? 40% experienced reproductive abuse, and specifically such as like coerced sterilization, untreated reproductive health. And then for TGI folks, gender affirming care is rarely provided. We're just starting to take steps to pass policies in the state of California that address some of the issues that TGI folks experience, right? 89% of incarcerated people believe that violence in prison is inevitable. So when we think of healthcare providers and their experience being there, there are plenty of ways that healthcare providers can intervene, that they can advocate for folks inside. And I think that, of course, I will always draw the issue back to capitalism. Lots of folks who CURB and folks in CURB have built relationships with, right, who work in the medical field, who are nurses and who are mental health providers inside of prisons and jails feel that they can't respond and that they can't stand up for people because they need their jobs. They need money. They have families to provide for. Many of them are also Black and brown folks, right? Who are fighting every day to survive the threat of criminalization. So keeping their job is their line of defense and protecting them from experiencing the very same things that they watch all of us who are incarcerated experience, right? And so what happened in LA, I think was really special because organizers said, well, you know what, let's build on that. And let's build relationships with people to figure out where there can be some intervening in such a way that maybe you feel protected at your work and you get to be an organizer or an advocate for people that you see experiencing this harm. What was really special that came out after this report, and I'll drop a link for you all in a minute, but what was really special, I think, is that after building relationships with healthcare workers inside, is that they started to show up. We had, nurses and mental health care providers showing up at the Board of Supervisors in Los Angeles County, giving testimony to say the environment for people incarcerated, we don't care what resources you give us as healthcare providers, the environment of prisons and jails will never be a place where people can get healed, right? One of CURB's taglines is, you can't get well in a cell. And so for healthcare providers to partner with us and to show up in these spaces where decisions are being made about people who are incarcerated, specifically women and their suffering incarcerated, was powerful. It moved LA County to say, we actually need to think different about incarceration. It moved LA County to say, we have to produce alternatives to incarceration. It moved LA County to say, let's investigate further the harms that women are experiencing, women and TGI folks are experiencing inside. And so I think that in thinking about, yes, unfortunately, healthcare workers don't speak up when a lot of these harms are happening. How can we move them, though, in a way that they feel safe in their own work to then turn around and join us in this advocacy? And that's what we saw happen in LA. People actually show up, people are building relationships. And as CURB is moving, and I'm so sorry if I'm talking too fast. I'm one of those who sometimes can't remember to slow it down. But in our statewide work to shut down prisons, as of course, CCWP was a great partner in being like, yo, let's focus on women here. And so the report that came out that I'm sure maybe Colby might dive a little bit more into is listen, the work that we built in LA County and that model of how healthcare workers can help build us toward a space where they're joining us in this fight to say, nobody can get well inside, let's release them all and build resources outside. We're experiencing that same kind of relationship as we're building with closing statewide prisons in California or state-owned prisons in California. We're building those relationships where folks are sending in support letters to us when we're advocating to the governor, to budget committees, where they're willing to show up with us on lobby days and really figure out how they can use their voice to because we're prison abolitionists here, right? So when state folks and folks in charge, the elected decision makers listen to us, it's of course you're gonna say that, you're a prison abolitionist. But when we can get healthcare workers and health providers to join us in that fight, they have to go, wait a minute, right? Because you're not necessarily impacted by this as far as they know. But you're this provider, this health provider, and you're also saying that people can't get well in a cell. And so I think that's a space where we're able to help folks own their power and realize their position as they're being healthcare providers in these systems. And we've seen so much change and support in that, which I think is just, I think it created a huge shift for how we approach prison and jail closures and freeing people in the state of California.
Whew, thank you. That is a whole inspiration and reality. And I want to name that at the Beyond Do No Harm Network, we want to be like completely upfront that we're aware of who we're asking to resist is also, as you say, the folks who have the least power in the system often, or even if they are the doctor at the hospital who has, you know, is a white cis man who can say, no, you're not taking the patient home, they need heart surgery. There's only, I mean, what is he going to do? Is he going to, you know, so we're trying to figure out how we can create networks of support around folks who are being asked to and are being called to not just to risk their jobs and their livelihoods in those moments to make sure people get the care they need, and also to speak out against the larger system. So I really appreciate you raising that. Colby, did you want to jump in on this report and how you're seeing folks resist? And I know that we mentioned Sharice earlier, and just this question of how neglect leads to death by suicide and other ways that folks are resisting.
Sure. Thanks, Andrea. And thanks so much, Amber Rose and the other Andrea, for already sharing so much. And just, yeah. So some of the things on my list I knocked off. But yeah, I think take a look at that report for sure. I know, you know, others and CCWP played a huge role in supporting with that collaborative effort, and including folks inside and out. And it's a great kind of summary of some of the key issues and some of the plan to close women's prisons and why it's essential. I will just, I'll focus a little bit briefly on some of the mental health care punitivity that we see in the prisons. And I know this is everywhere. Our experiences in the women's prisons, mostly in California. And, you know, in not too long ago, there was a really escalated suicide crisis in the women's prisons here, particularly at the California Institution of Women that's east of Los Angeles. And, you know, it was inside organizing among people trying to support each other's survival, and family members who lost their loved ones, their daughters, inside in the suicide crisis, and other formerly incarcerated folks and advocates at CCWP joined together to expose the crisis, right, which was completely off the radar. You know, even by the point that we were able to talk to people in the state legislature here, they claimed that if they did anything, it would make it worse because of quote unquote suicide contagion, which made no sense. You know, at that point, that particular prison, CIW, the suicide rate was 8 times the national average rate for people in women's prisons, right? Like egregious level of neglect and mental health abuse that was leading there. And so, you know, we organized with people inside and out to demand an end to the crisis, to, you know, to support people trying to survive through the grief and trauma of losing their loved ones inside and out. And in that process, learned so much about, you know, the ways that the mental health, quote unquote, treatment system in the prisons is, you know, just directly a punitive isolation approach, right? So the more that people show signs of mental health crisis, the more isolation and punitivity they face. Like, you know, they literally have a pyramid that shows this response to escalating crisis, and the response is escalating isolation and punitivity, right? And one of the ways that I personally witnessed some of that medical violence, you know, is that once people were isolated in segregation, which they call suicide watch, you know, 24 hours, bright light, lack of access to anything or anyone, they would rely, the people on suicide watch would rely on these medical tech assistants who sit in those turning chair desk things, you know, like literally outside of the cells, looking at them theoretically 24 hours a day. And, you know, their only direct person that could theoretically bring them basic needs like toilet paper or menstruation pads that people have to like somehow stand up and hold with their bodies because they're not allowed undergarments, right? Like the direct link, you know, to anything to support people's survival were these medical techs who, you know, were told to not do anything, right? To not provide XYZ, to call custody, to provide toilet paper, right? And, you know, we didn't see, and I would get in for visits there directly with people, and so would also kind of witness this. And we didn't see much resistance there, but I will say in the spirit of healthcare provider resistance inside, that in 20 years, I just personally have only seen about 3 examples of healthcare providers doing direct resistance that have helped keep people alive or facilitated people's release. And even though there have been so few, those examples, have literally been life-saving, and also have directly led to people's chance at a medical reprieve or, release from prison. One of them, it was a medical provider just literally sneaking in insured to keep a woman alive who was on suicide watch and medical isolation at the same time, who had attempted suicide and who they just wanted to die, right? And so she was smuggling insure, which she had been ordered by the doctor, right? But the staff there, medical and custody, wouldn't provide. So I say that to say both resistance in some cases is possible in those settings. Some people lost their jobs, obviously, because of it, right? But I would say it's worth it if you're keeping somebody alive, right? Or if you're helping somebody get home. And so that, and then I think I'll just a quick note on, piggybacking on what Andrea said about transportation to outside medical facilities. We were talking kind of over time in CCWP about doing some kind of more dedicated organizing project on this and trying to figure out how to do that in an abolitionist way. Andrea, James, would be great to connect on this too, if you all already have done work or would want to partner. Because of story after story of people being shackled, of people falling, right? We had an elder pass away last year after falling, being shackled in transportation. And then, getting to these outside medical facilities where, there are, I think, more opportunities for healthcare providers to resist, right? To refuse. And I know it's complicated, but we've seen it happen from county jails. From county jails into the county hospitals, where some radical teams of medical providers have found ways to resist, what they're being told to do in terms of how they treat people, in terms of the shackling, in terms of access to food and water, right? The horror stories are, just incarcerated people being shackled and held in basement rooms, waiting on appointments, right, for upwards of 12 hours, not being fed. And there are ways, and I think on the county level, more so to resist that violence and potentially to expose it in ways that can force more change. So I will leave it there. Thank you.
Thanks so much, Colby. I appreciate you naming that, even though they're few and far between, that those stories are life-changing to really invite people into being part of those stories, whether it's outside of facilities or inside. We are starting a story collection project to get more of those examples out in the world so that healthcare providers can see how other healthcare providers are resisting in the way that you just described. And there's a resource that was just dropped in the chat of gathering some of those stories. And one of those stories is of a healthcare provider who blew the whistle on forced sterilization, which is, I know, another thing that CCWP does a lot of work on, and we might not have time to get to tonight, but folks should check out your work around that. And but there's others, and then we know there's others in this room, because you wouldn't be here as a healthcare provider if you hadn't at least thought about how to resist the carceral collaboration in the past. And so we hope that you'll join the story collection project. We'll drop a link in how you can tell a story of how you resisted in the chat, so we can continue to amplify those. I can't believe the time has gone by so fast, but I'm going to ask Jason to answer this question, and then I'm going to come back around one more time to all of you for kind of a lightning 1-minute round to just tell the healthcare providers and allied folks in the room something that they can do that to support the work that you're doing in a way that both provides care properly to folks who need it inside and argues to get them out, or both. But Jason, I wanted to come to you both because you've documented these kinds of stats that that Amber Rose was sharing in terms of queer and trans folks lack of access to care, and you have also experienced how folks inside resist lack of access to care, and also have seen healthcare providers support that. And then also, as you were saying earlier, had your own experience of what the response to mental health crisis is further punitive and violative in ways that are not helpful. So whatever you're willing to share around those points, we would love to hear them.
You bet. There are so many things to say and so many more horrible stories to tell. My minister self wants to kind of hold us all and be like, this is heavy, this is horrible, this is white supremacy and anti-Blackness and settler colonialism and the carceral state, and we need to take care of each other. So please take care of each other. I want to start by sharing a quote from someone who doesn't get quoted often in these spaces very on purpose, Mr. Clarence Thomas, Justice Clarence Thomas, who in Farmer v. Brennan, which really sets standards for deliberate indifference for prisoners. He says that prisons are necessarily dangerous places. They house society's most antisocial and violent people in close proximity to one another. And I couldn't agree with him more. He means prisoners. I mean the rest of the system, right? That this is a system that is rooted in so much violence that it makes so much sense that medical providers within it are part of the same problem that everybody else is part of. And yet, I also know these many examples or these few examples of people who have fought back. And I wanted to highlight a few. One, we can't learn enough from the work both of prisoners and providers around AIDS epidemic in the 80s and 90s. We cannot learn enough from them and what was done, how folks who were clinical providers and caregivers refused to be paid by prisons and jails, but provided the care for people on the inside, where prisoners themselves created hospice units where they were taking care of one another and were figuring out ways to do that. We can't tell enough of the stories, and we need to tell more of them so that we can shape and learn from that experience and apply it across the board in lots of different areas and ways. There's great stuff from particularly upstate New York prisoners who are doing so much both in women's and men's assigned prisons, where people created prisoner generated projects that were supported by ACT UP, that were doing all of this work to create education inside, but also providing as quickly as possible medical support to people inside. And again, I think it's really important for us to think about the ways that providers can be consultants, contractors, other ways of operating without being staff people of the prison and jail itself. When the accountability is to patients as opposed to the Department of Corrections, there's a much greater possibility. It's still no guarantee, but there's a greater possibility of people getting the care that they need. In Boston, for years, there was a contract between Nashua County Jail and Boston Healthcare for the Homeless for trans women in particular to get access to trans-affirming healthcare by one specific provider who came in and did all the trans-specific care. She was somebody that people came to trust, and because, as we all know, the county jails are places where people rotate in and out, she got to know folks on a pretty regular basis of who needed what type of care over what amount of time, and making it so that folks who may have been taking hormones on the street who might not have had a prescription, she could then write a prescription based on what it was that they were saying they were taking, not based on what she thought, not based on whatever, but based on their experience and her knowledge and wisdom, as well as a provider, to make sure that things could happen. And that was a really beautiful way of being accountable to incarcerated folks for their care. I do want to just take a quick moment as an aside from this. Here in Chicago, we have this beautiful campaign called Treatment Not Trauma, fighting to get it so that there would be healthcare providers who respond to crisis situations as opposed to police. And there's lots of these efforts kind of growing around the country. And one of the things that's a huge problem, though, with all love and endless love and respect, is that treatment often is trauma, and that what we're putting people into and what we're sending people towards, we need to be careful and cautious about what we're doing. Having recently experienced time in mental health facilities, again, One of the folks I was, oh, excuse me, I apologize. One of the folks that I would say, incarcerated with in this mental health facility talked about how we were being punished for trying to kill ourselves. And that they were trying to make the treatment as terrible as possible so that we wouldn't want to go back, so that we would do whatever we could to not end up back in the mental health facility, not to actually heal ourselves, not to be taken care of, but to avoid the punitive nature that is the mental health care facility. And so I think we have a lot to learn also over and over again from what Ruth Wilson Gilmore calls non-reformist reforms, or what other people call abolitionist reforms, and make sure that we are engaging and taking on projects. And that's exactly what I feel like you all are trying to do. And I'm inspired by you, and you are beautiful. Trying to figure out what are our efforts and campaigns and projects that can be done that are whittling away at the system, and coming up for yourselves a list of questions. I have a list of questions for myself that I've been using for the past 10 years to kind of be like, is this an abolitionist project or no? And it's not always black and white. It's gray and messy. And we also get to challenge each other. We get to say, hey, this thing you're doing, I actually think that's kind of fucked up. And we get to then say back to each other, oh, whoa, hold on, let me think about it. And we can disagree and have dialogue. That's the point of being in a movement. None of us has the abolitionist solution. If we did, we would have already won by now. Instead, we're trying different bites at a time. And so one of my hopes too for you all is that you try things on, and then when you make a mistake, you own it and don't make that mistake again, make a new mistake the next time. And that we're doing this abolitionist work collectively, and be okay with the pushback, and be okay with it as we get close. Because also as medical providers, you too, hopefully you think throughout medical care history, which as fucked up as it is, there's also opportunities for pushing back and saying, oh, this implementation is not quite right. Let's change it up. Let's tweak it like this. Let's do that. And let's get closer to a real solution. And so hopefully that's what you're able to do in this collaborative.
Whew, Jason, thank you. So we are gonna give our interpreters a break in 5 minutes, but yes, Maria is thinking out of my exactly what I was thinking. So we have a bunch of lists and checklists for thinking about what kinds of reforms are going to build more prisons. Like, we need a trans prison. We need a prison where people can give birth and have their children with them. We need a prison where elders can be cared for. We need a prison where, no, none of those things should happen, because none of those people should be in cages. No one should be in a cage, and none of those things are going to provide care in a cage. So this binder should help you kind of ask yourself questions about whether we're veering into providing care in a way that's going to perpetuate the system and keep people in cages, or whether we're veering into a way of providing care that is going to lead, as Amber Rose was saying, to saying actually nobody should be in the cage. And to Jason's point, whether we're providing care in a way that respects people's autonomy and dignity and healing, or whether we're providing care in a way that's coercive and violent and violative. So we are actually doing a session on coercive healthcare that's not in a cage, but that is coercive, that Maria will drop a link to, that you should join on that. We also have a practice space for folks who are building coordinated crisis response in community, and making sure that it doesn't go the way that Jason is describing, that instead of putting someone in a cage, we put someone in another cage, called coercive care. So we want to make sure that we're building crisis response that doesn't substitute one for the other. And we will have other sessions about respecting people's self-managed care and how we can avoid participating in criminalization of that in the ways that Jason was describing around gender-affirming care. But in our last 4 minutes before we take a break, I'm going to ask each of you in 1 minute, speaking slowly, to point these folks in this room to campaigns that you want them to get involved in as healthcare providers around these issues. And I'm going to start with you, Andrea.
I just want to say thank you to everybody for all of the incredible things that you're lifting up. For us, and I want to shout out, our folks, our people who are on the ground, fighting for compassionate release, fighting for clemency. We, Mallory Honora, I noticed is on here. She's just a phenomenal, brilliant leader in our space on this issue. Sashi and Mallory have just been leading campaigns to push women out, but mostly focusing on sisters who are sick, sisters who are elderly, sisters like Rosie Baker, who is at Caswell, which is a prison that we hope to close, medical prison in the federal system. And Rosie is 80 years old. She has dementia, full-blown dementia, and recently got what we call a shot, a disciplinary ticket or a shot for wandering into a section. When we're in the prison, you can't go from one unit to the other. You have to stay where you're allowed to be. And she wandered into another unit and couldn't find her way back. And they gave her a shot for that. She should get compassionate release immediately. If we just started there, we could literally, there's a woman here in Massachusetts with dementia. I mean, they don't even know who they are or why they're, or where they are or why they're incarcerated. So that's kind of really low hanging fruit that people can really get on board with these campaigns. Clemency for women like Michelle West, who has been in prison for 30 years. Danny Metz is our clemency director and leads that work in state and federal prisons. Women who just are sick, they're long timers, they're dying, they're literally dying. And we have wardens and governors like in New Orleans, Louisiana, who just announced a multi-million. It's going to cost about $1 billion by the time they're done. But he gloated about building a brand new, beautiful hospice. I mean, if somebody is in hospice, they need, like, it's just, so we have to find these campaigns. Look at CCWP, look at CURB, look at the work that all of us here are doing. We'll give you a bunch of different examples of cases that you can work on and help us survived and punished. I mean, help us to use tools that already exist. We don't even have to create new tools. They already exist to help. And so I would just say that. And lastly, very quickly, and I know I'm sorry, but this is really an important point. We must tell the truth about prison medical treatment in court filings until judges finally get it. That the care inside the walls is horrendous. And under a federal statute, a reason for denying compassionate release is the need for further medical care. It's outrageous. We get that response in so many of the filings we do on behalf of very sick people in the federal system. And so obviously we need to make clear that the BOP, the Bureau of Prisons, cannot provide care that consistently meets any kind of minimum standard. And so we have to put that into the filings. We have to keep hammering away at that so that we can dissolve, get rid of, make judges understand that what is being demanded, more medical care, is exactly the problem. And so I want to say again, thank you.
Thank you so much, Andrea. We really need to hear that. And we want to make sure that we also don't give our captioner a repetitive strain injury. So Colby and Jason and Amber Rose, do you have a short invitation for folks to get involved?
Yeah, I can just jump in to say we'd love for folks to stay connected with CURB. We're right now fighting to close more California prisons. It's happening. You know, folks have been working so hard to reduce prison populations where it's happening. We want to definitely hone in on how women should and folks in women's prisons need to be released, right? And making sure that we don't reset those spaces to be carceral spaces after we've shut them down. So please join in our efforts here. We definitely also are fighting against Governor Newsom and his brilliance, has said that we should be transforming San Quentin Prison into a rehabilitation center that will be the California model that's copying the Norway model prison. Yuck, okay? What we know is that if this happens, it's going to turn into gender responsive prisons. It's going to turn into medical facilities for women and all the nasty things that we see happening over and over, right? Like, there's no new tricks with prison construction. It's all the same song over and over. So join us at CURB in our advocacy here. There are ways to participate virtually if you're not in the state of California, to help us push back on these ridiculous models for revamping prison construction, also to continue to get people released and to close more prisons. curbprisonspending.org, or you can reach out to me, Amber Rose, at that same handle, Amber Rose at curbprisonspending.org. We'll get you plugged in. All of our member organizations, including California Coalition for Women Prisoners, including Human Impact Partners, including so many others, Justice LA, who's doing incredible work in Los Angeles. Wherever folks feel like you can fit in, we will find you a space to participate. You understand what I'm saying? Everybody's not going to do the same work, okay? But we will find you, if you just tell us what you're able to do and what you want to do, we will find you a space to get, you know what I mean, involved, okay? So that's it. I'll pass to Colby.
Thanks, Colby. Go ahead.
Thank you all. Okay, so just a couple quick things, but I'd say generally, if people are available to support with any of CCWP's work in California and our partners, we greatly support that. info@womenprisoners.org would be a good way to connect and offer ways to connect. Some campaigns to plug into are, as Andrea mentioned, the sterilization reparations implementation kind of part of the project happening now. We are building out a bigger campaign around sexual assault by prison guards for many reasons, in collaboration with survivors of sexual violence by prison guards inside the California prisons. And so stay tuned for ways to plug in on that, and really encourage and support people to, on the medical side too, to get involved in campaigns to stop transfers from prisons and jails to ICE. Obviously a medical issue, medical violence issue, and mental health violence issue. And then last I'll say is, through my day job at UCLA, I'm working on this project about releasing elders, people with cognitive decline, people with life-limiting illness, through the many, many pathways that we have available to us already in California for that. And I know that there's work, very related work happening at National Council, so we should connect on that too. But for, healthcare providers who want to support that work, there are so many ways to plug in, including getting into the prisons to do medical evaluations that people can't get inside that could support people's release. So I'll end it there.
Thank you. Jason, last word about how folks can get involved, and then we'll go to break.
I've been a broken record for the last 20 years. If you are not currently writing to somebody who's incarcerated, you should fix that immediately. You can do that through Black and Pink if you want. You can do that through lots of different religious organizations. You can do that through writetoprison.com. There's just write to somebody. Be accountable to someone who's currently locked up. It also makes a big difference when people are receiving mail. Mail call usually happens in general areas. And so when your name is never called, people notice that nobody's paying attention to what's happening to you. And so we think of mail call as also a time of hopefully reducing the harm that people are experiencing by having folks on the outside show up, show love, show care, show support. So just regular communication with someone on the inside can really make a difference in their lives. And yours.
Indeed. Okay. Thank you all so much. I'm so grateful to all of you for all the work that you're doing, and and so grateful to you for making the time today, because I know each of you is really busy doing this work, but speaking to this crew hopefully will yield multiplied outcomes. So thanks for being here. We're going to take a break for 10 minutes to give all our Access team a break. During that time, I really invite you to think about how you could interrupt some of the things that you heard about today, and then come back to go into a breakout group and talk about it with other people. So we'll come back at 25 minutes after the hour, and we'll have some time to get into that conversation. So thank the panel again, and maybe during that 10 minutes, you could journal some ideas about how you could get involved so you can bring that to your breakout group when you come back. 25 minutes after the hour. We'll see you then. Thanks again, everyone.